Welcome to another interesting session from Coach Minister. Hello, everyone. Myself, Dr. Anjana, your host for this evening. Today we are very excited to introduce our guest speaker, Dr. Shaheen Sheikh. She is a registered doctor in Australia, having successfully passed both AMC, MCQ and clinical exams, and she's also obtained the provisional registration from AFRA. So many congratulations, Dr. Shaheen, on that.
Thank you
Dr.
so much.
Shaheen, she has completed her MBBS from the Shadan Institute of Medical Sciences, and she has also got a fellowship in emergency medicine from Medicare. Uh, she's a hardworking and dedicated medical practitioner. Currently, she is serving as a resident medical officer in Queensland. She's also a tutor and clinical trial examiner for individuals preparing for the AMC clinical exam. With over 4 years of medical practitioner experience in India, she brings a wealth of expertise to her current endeavors. So, she also wishes to utilize her expertise as a doctor to provide comprehensive and patient centered care while contributing to healthcare team's success and fostering positive health outcomes. A very, very warm welcome to you, Dr. Shaheen, and thank you for joining us today. We are a bit late in starting this podcast, and I'm sure it will be a very inspiring and enlightening session to all our young medical graduates who are listening to you today.
I hope the same. Thank you so much for having me, Dr. Anjana.
Yeah. Let us begin this session by, understanding your early medical career days, Dr. Shaheen. As we all know that many doctors, they are motivated by a desire to help people and everyone. So what about you? What drives your passion for medicine, and how did you get into this medical field?
So the thing is, I think this is something that runs in everyone's blood back in India. So for me, as especially, my grandparents are from a very small village back in India, and so there is no particular good amount of doctors or hospitals over there. At least
Okay.
I'm talking about 20 years back. So I used to see my dad's distant cousins. They were very ill, and they did not have a good sources where they can go and get treatment done. So that's something that motivated me very early back in my childhood itself,
Mm.
and I made a decision back then itself. I'm in fact the first doctor in my entire family. It's
Oh,
only after
amazing.
Yes, it's only after me, my distant cousins now they're getting into the field, but I'm the first one. So yeah,
Okay, so you have become an inspiration for your family members to take up this field. That is, that's a great thing. Okay, okay. Do you have any mentor or someone you look up to who has influenced your decision to become a doctor?
Honestly, I don't have any mentor as such. As I told you that I am the only one in my
Hmm,
family. But
right,
everyone, it's not necessary that I have to be a doctor. I believe in women empowerment itself. We
absolutely.
don't have to definitely be a doctor itself. I choose this pathway, but every woman out there who is doing great in her own careers and who are working hard, each one of them are very much like a mentor to me itself. So I would say that, yeah.
Okay, okay. How was your journey in the medical school? We all know that medical school is very demanding. Studies in medicine is, very time consuming and all that. So, what were the biggest hurdles that you faced during your medicine study, and how did you overcome those problems?
So, Dr. Anjana, you also know that it's, as you said, it's very demanding.
Yes.
So it was very taxing for me as well. Upon
Hmm.
the academic pressure, I also had the pressure because I used to travel a lot. My college was very much far from my house, and I didn't want to
Okay.
be in hostels. So I used
Mm-hmm.
to travel every single day, almost 2 hours to go and 3 hours to come back. So almost 5 hours daily travel. The commute
Oh,
itself
okay.
took up a lot of time, and then
Mm-hmm.
managing and everything, studying every single day. I think time management is all. It's all about time management. I used to come back, rest for some time, and then study every single day. I think that
Hmm.
literally helped me out a lot. But
Hmm.
definitely, as you know, the medical college, it's very very challenging. But I think
Yes.
with time management, you can definitely do a good job.
Right, right. Personally, I used to find first year, because I'm a dentist, and personally, I felt first year was very challenging for me because we had anatomy and we had
Yeah.
microbiology and all that. So personally, I felt first year was very demanding because we were also getting adjusted to the medical
Mm.
scenario as such, and then probably after that it was a bit better because we knew what to expect. Maybe that
Yeah.
also helped. Right. So, in that way, did you find any particular subject demanding, or how was it?
So just like you said, Dr. Anjana, same thing. Anatomy in the first year, because just
Yeah,
entered into MBBS,
exactly.
anatomy is thrown at your face. So it's
Hmm.
really very hard to do anatomy. Struggled a
Yes,
lot with that. Everyone struggles. If they're saying they did not struggle, then they're lying about it. Because
yes,
yes,
true.
anatomy is very very exhausting. But
Hmm.
every year there was something. Especially, I think in the final year, there was a lot
Hmm.
of pressure on us, because if you don't pass your exams, you're not going to go into the internship batch,
Internship phase,
then you
yes.
will
Huh.
stay back. So that's something we had a lot of pressure. Plus, also do your clinicals. You have to be in the
Hmm.
round, go
Correct.
visit your patients, and same time you have to manage everything. So it was very
Right.
demanding, especially the
Hmm.
medicine. If I think about my medicine exams, it still gives me nightmares. So yeah.
Yeah, yeah, right, right. I can totally relate to that. So coming to your early career, so you worked as a casualty medical officer and also as an emergency medical physician in different hospitals in India. So how was that particular experience, and why this particular emergency field? Or the casualty field, which I think most of the doctors dread because they're not prepared for it.
Yeah, you're right, Dr.
Yeah.
Anjana. So this is very challenging field, but honestly, I
Mm.
think it just happened to me. I was working after I cleared my MC one, so I decided I'll work for some time in India. So I
Right.
decided to I got a job. I was just wanted to work as a duty medical officer, and once the
Hmm.
management put up a question that would you like to work in the casualty. By then, I did not had any experience, but they said they
Hmm.
would be helping me out, and it was a kind like a rural hospital, so we had a lot of patient
Okay.
attacks. So when I went in, it was very scary for me as well, but you have to take up the challenge and you have to be on your toes, but also it gives you the satisfaction of saving a life the most. Emergency
Absolutely.
medicine is the most one, because you get the most critical patient. Of course you lose
Hmm.
lives as well, but you also
Hmm.
save lives. So that was very interesting, and I automatically started loving that field. And that's how I decided, after working for 6 months as casualty medical officer, I decided I want to pursue my further
Hmm.
education there, and I did my fellowship in emergency medicine. And yeah,
Okay.
that's how this journey
Okay.
started.
So I think that is one thing, saving a life is something what every medical grad and every medical practitioner strives for,
Yes.
right? That is what gives us the high, as they say in the
Yeah.
medical field. So, how has your experience in these Indian hospitals helped your current medical practice?
Yeah, have helped me a lot, because I have been exposed to a lot of cases, being
Hmm.
MI management, all acute poisoning cases management, seizure management, to
Hmm.
working in wards. I've also worked in gynecology wards as well. So I used to work in those. I know now what to expect, what medications to write, to
Right.
prescribe, and what to
Hmm.
expect on a patient's progress. What are the vital signs to have to look out for? What does an emergency looks like? So all of this have definitely helped me and given me a very good amount of knowledge, so I can definitely
Okay.
apply that here. Yeah.
Okay, okay. So that has been like maybe that has been your base because you
Yeah.
immediately joined here in this thing, right? So now coming to your stint in Australia, your current practice. So how has your experience been in Australia so far?
Australia is wonderful, Dr. Anjana, to put in a single word. It's been amazing here. The
Okay.
country is gorgeous, and so
Hmm.
is working here. Everyone is striving for women empowerment. If you see,
Hmm.
Australia has 51% of females working. So there are more amount of females rather than males who are in the working sector. That itself will answer your question. So
Yeah,
it's
speaks for it.
amazing.
Yeah.
Yeah, it's amazing over here. Everyone strives to be best. There's lots of work-life balance here, which is
Mm-hmm.
very hard to find back in India, to be
Hmm.
honest. So here you see that if they care for their doctors, they care for their healthcare workers. They also strive that we shouldn't have fatigue. So
Hmm.
because it can affect our clinical decisions as well. So I think
Absolutely. Huh.
I have loved my experience here.
Okay. So So, what similarities or differences? You have mentioned a few already, but if I want to specifically ask, similarities or differences that you see with your practice back in India and now in Australia.
So when it comes to India, again, as first things first, I want to point out this to everyone that it is the work-life balance. We don't
Hmm.
even get leaves over there. We hardly get
Hmm.
any, maybe 4 leaves a month. Here, we
Hmm.
get 2 leaves a week. The work
Okay.
is like not more than 40 hours a week, and then
Hmm.
you get a 5 week a paid annual leave as well. So that is one
Okay.
thing, is they manage your fatigue very, you know, that you work for 4 days or 4.5 days, and then you get 2 days of leave, which is not
Correct.
common back in India. People from IT
Hmm. Hmm.
sectors do get leaves in the weekends, but people from
Hmm.
our background, healthcare background, we do not get that chance. There's lots of fatigue
Correct.
because in India are exhausted because they are
Yes.
overworked. Any
Hmm. Hmm.
sector you go, private or public sectors, they are overworked. So I
Hmm.
think that is first thing. Second thing is the pay parities, I would say. Pay
Hmm.
is even for the junior doctors, not just junior doctors, even nurses, they're paid
Hmm.
very good amount, very good salaries. So
Okay.
that also is a very good thing I love about Australia. The pay, the
Hmm.
work culture, the educational opportunities you get over here. Of course, in India you have more number of cases, you have, because the population is larger, you're exposed to more number of people. Whereas Australia, of course, there's a set of different diseases you're exposed here to, for example, from airborne diseases, or be it just like some developed country diseases like type 2 diabetes and all that
Hmm.
stuff. This is some
Hmm.
difference over there. So experience wise it's different, but I think, if to put up in points, pay is good. The pay difference, I've seen the work life balance difference, and the respect and everything here in Australia. Every healthcare worker, or be it even the person who cleans the bins, also is respected equally. Everyone
Hmm.
at human level are respected equally, and you
Hmm.
cannot be rude or rash, or you cannot be what do you say, yeah, disrespectful towards anyone here.
Yeah. Yeah.
That is something I
Okay.
found here compared to
Hmm.
India. The
Yeah.
differences, yeah.
So unfortunately, as you mentioned, the safety of doctors in India is a big question mark, especially when it comes to government
Yes.
setup. Recently also we had a case where the abuse on doctors. It is continuing. I mean, that is one thing that I think everybody needs to, the government and everybody needs to work on. Probably when it comes to Indian setup. So that is a good thing to know that in Australia it is different and it is that is
Yeah.
not the case scenario.
Yes.
Okay, that is great. Have you faced any challenges currently that you're practicing in Australia now, and how are you coping with those challenges?
Challenges is the expectations from doctors. If you see here, even MBBS is for 6 long years, and then that
Hmm.
is without counting the internship. Back in India, we do it for
Okay,
5.5 years,
5.5 years.
including the
Yeah.
internship, right?
Hmm.
So
Hmm.
the doctors here are expected to not just do the ward work or diagnose, but also do the basics of cannulation, urinary catheterization, fast ultrasound interpretation, and even cast. You have to be able to apply a cast and all suturing
Okay.
and everything. So the
Hmm.
because back in India, nurses do the job of cannulation or
Yes. Yes.
catheterization. That is not expected of nurses from here. It's a doctor's job over here. So
Okay.
and because they follow very aseptic protocol and everything. So I think those are the difference. Which, because for me as a doctor from India, I am not strong in those sectors, but that is what is
Hmm.
expected out of me over here.
Hmm.
So very well, it's each country has their own expectations. So what I can do is just educate myself, involve myself in workshops. They also have amazing workshops,
Okay.
recertifications, do lots of modules, the
Hmm.
PLS, ALS, BLS workshops as well. So we do all of that stuff, and yeah. So that is one thing I felt like, something, a job which the nurses were experts back home is something we
Hmm.
have to be experts here. So
Okay.
that's a challenge I'm facing, but I think hopefully with educating myself, I'll be able to overcome that.
So you mentioned about the PLS courses. Can you
Yeah.
just briefly elaborate on that? I mean, slightly, if you can elaborate on that.
To elaborate, it's like every hospital. When you get into the hospital, they will, even before getting into it, you have to do some ALS and BLS, ACLS and the BLS courses. You need to have
Okay.
certifications. I think even
Okay.
back in India, we all have, all the doctors do that BLS and
Hmm.
ACLS. You have to keep
Hmm.
certifying yourself. Similarly,
Hmm.
before getting here also, these will work in favor if you have the certifications. You don't have to do it from like a very big spend a lot of amount. For
Okay.
ACLS or PLS, you can do online courses as well. It's
Okay.
easily available for Indian graduates as well, so you can go there and do the have certifications. And when you get into the healthcare system here, they keep educating their doctors and nurses again and again. Every year they hold these workshops that is free of cost. You don't have to pay anything, you just have to
Okay.
attend it.
Hmm.
Again, you'll be getting your certifications. So
Okay.
but,
Okay. So yeah, so it's a continuous learning process where you're trained again and again. Okay, that's a
yeah.
great thing. Yeah. Also, as I mentioned in your introduction, you are an AMC tutor.
Yeah.
So can you just let us know how you're helping the fellow medical graduates as an AMC tutor?
So I always had a passion for teaching. If I wouldn't have gone into becoming a doctor, I think I would have been some professor or something. In Australia, I
Okay.
fulfilled that dream of mine. So I've joined. When I came to Australia, I joined ARM Gases, which is Aaron Roberts Institute. So there are
Okay.
lots of institutes available which will teach you and guide you towards AMC. So
Hmm.
I did my AMC one from back from India itself. It's a MCQ exam, 150 MCQs. In that, you have to have a 50, getting 50% is the passing rate in that. So you have
Okay.
to be able to do half of it at least clear correctly. AMC2 is a clinical where you have to do OSCE. It's a OSCE station. OSCE is like a clinical examination where you have every station will have a pretending role player like a
Hmm.
patient. You have to go in and you have to diagnose, treat them, manage them depending upon the task. So for
Okay.
that sake, I have joined the course. I did my course and then I cleared my exam and I became a tutor over there. And
Okay.
I now teach the fellow doctors from all the countries, not just India, but every other countries, all possible. I mean, Bangladeshis, Pakistanis, be it Chinese, Japanese, and whatnot, Iranians,
Okay.
and everyone else. So we
Okay.
all of us. So we have a course where we teach them how to do role plays, how to if we get a scenario, how exactly what is AMC expecting out of you. We
Hmm.
teach them that. And we
Hmm.
also conduct workshops. We conduct physical examination workshops as well for them
Okay.
to understand what kind of examinations should be done. And also
Hmm.
I make trial exam questionnaires as well,
Mm-hmm.
simulating the ones we have in the main exam, the 16
Hmm.
stations. So we have out
Right.
of 20 stations, 16 stations will be scored. Of them, two will be pilot, which is not scored. I mean, yeah, 16 you have to perform, two will not be scored. So 14
Okay.
out of 14 you have to get 10 to
Mm-hmm.
pass this. So yeah, that is what I also make those trial exam questionnaires. I'm also trial exam examiner as well. We also conduct trial exams, which are very helpful.
Okay.
So yeah,
Okay.
that's what.
Okay, amazing. Now that you mention all these about AMC exam, so let's dwell deeper into the AMC exam itself now. So basically, the first question will be as to who can appear for this AMC exam.
All the MBBS graduates anywhere in the world can appear. They just need to have their registration. Their degree
Hmm.
has to be registered in their
Hmm.
particular country wherever they had done their MBBS. Some doctors might do MBBS in one country and they clear their own country exams. Like in our India, we have to do FMG, and if you have been
Hmm.
an MBBS graduate in another country, you have to get your degree registered in India after clearing
Correct.
FMG. So
Hmm.
wherever, whichever country you are, if your
Hmm.
degree is registered, MBBS, you have registered degree, then you can apply, make a portfolio in the AMC account. You have
Mm-hmm.
ECFG as well. So they you have there's a couple of process. Once your account is made and they have verified your college, if AMC thinks your college is a verified college, then you can start applying. Yeah.
Okay. Okay. So this can be done, once you have completed your internship. It cannot be done before that, right? That is what I understand.
Yes. You have
Okay.
to do it
Okay.
after
Perfect.
it.
Okay, okay. So, what is the exam pattern? I know you have briefly spoken about the MCQ and all that, but still to go into a bit detail about it. So, what is the exam pattern of the AMC?
So MC, we have two steps. Like USMLE has three steps. AMC has two
Hmm.
steps. First step,
Okay,
as I told, is an MCQ. Second step is the clinical. So
right.
MCQ is basically all your final year subjects, your medicine, pediatrics, gynecology, and
Hmm.
we have other subjects like derma, radiology,
Hmm.
pharmacology is also touched. And so you have surgery as well. All these subjects
Hmm.
are almost 12 different subjects. And
Hmm.
you'll be having all clinical based scenarios. Nothing, no one is going to ask your pathology, and no one is going to ask your microbiology and all that stuff, but they will rather
Okay.
ask you, like, if you get a scenario clinical based, how you will treat it, your best approach. That's what they
Hmm.
judge you on. And that is for
Okay.
150 questions. Of them, 30 questions will pilot, which means they're not marked. So you will not be
Okay.
knowing which questions are not being marked. You have
Oh,
to attend the
okay.
whole 150 set, and there's no
Okay.
negative marking, which is very good.
Hmm.
And you have to at least get 50% to pass this exam. This exam
Okay.
also has 50% pass rate, which means of the 100 candidates who give the exam, 50 people pass it out. And
Okay.
there's no number of attempts for this. You can give unlimited number of amount of attempts. Then coming to
Okay.
AMC 2, only after clearing your AMC 1, you'll be eligible to give clinical examination. Once you
Hmm.
give clinical examination, is like now it's both online and face to face. Earlier, before COVID, it was just face to face, and the
Hmm.
center was only in Melbourne. But now they
Okay.
have made it online, so you can sit at the comfort of your home and give this exam as well.
Oh,
Now,
amazing.
yeah, both face to face and online, you'll have 20 stations, of which 4 will be rest stations. 16
Okay.
will be the stations you have to perform, of which 2
Hmm.
will be pilot, which won't be marked, but you won't be told which are pilot. You have to perform 16 of them. And between
Hmm.
these stations, you'll have some rest stations, will be like these 4 rest stations which I'm talking about. They'll be in
Okay.
between. So, yep, if it's face to face in Melbourne, we have center. You have to go there and perform. And if you're
Okay.
doing online from your home, you can do it, of course, in
Okay.
Australian timings. Now, this year we do not have any face to face exams because the center is closed. They're building a new center. So,
Okay.
this year only online exams are there. From next year, or probably by end of year, we might have face to face back again.
Okay. This exam happens, the AMC first set, which is MCQ based question. So that will be held twice a year, or how frequently is it held?
Oh, that's a good question, Dr. Anjana. So, normally in Jan and December, AMC is on
Hmm.
holiday. Australia is on holiday at that
Okay.
time. So no one works in December to
Okay.
January. So only in these 2 months, you won't be having any exams. But from
Okay.
Feb to November, both clinical and MCQs will be scheduled. You can go into
Okay.
your portfolio and you can book your exams from there.
Acha. Okay. So you can do it throughout the year except for the months of January and December.
Yes.
Okay. You mentioned that you have close to 20 stations, which are 4 rest stations, and 16 which are patient. You had somebody is acting as a patient and all that. So for this entire 16 stations, what is the time duration that the candidate has?
Oh, very good question as well. So you'll have 2 minutes of stay. You'll have a scenario given on your
Huh.
screen. But if you're
Hmm.
giving on it on your own laptop, or if you're giving face to
Right.
face, you have a screen outside. You'll get a
Okay.
scenario. The bell will
Hmm.
ring, and for 2 minutes you have to read that. And after
Hmm.
2 minutes, you have to go inside and perform the case for 8 minutes. So overall 10 minutes,
Okay.
2 minutes to read the
Okay.
case, and 8 minutes to perform. And each case while performing, they'll have multiple tasks. Some will have just a counseling station. You just have to
Hmm.
counsel the patient. Somewhere
Hmm.
you'll have history taking, give diagnosis, differential diagnosis. Some will have
Hmm.
management as well. So it depends case to case. And we also
Okay.
have physical examination where you have someone coming with a knee problem, coming with thyroid issues, coming with other different problems, and you have to examine how well you
Okay.
examine a patient. That's what they judge you on.
Okay, okay, perfect. Now, for the AMC one, specifically, if I have to ask, are there any particular subjects that the students can concentrate on, or some subjects which have more weightage compared to other subjects? Is it something like that, or all subjects have an equal weightage? How is it?
No, no, Dr. Anjana. It's just your final year subjects, as I think I listed
Okay.
before. So your medicine, surgery, pediatrics, gynecology, then your pharmacology will be a bit important.
Mm-hmm.
Dermatology, radiology. These are the few things that they have to concentrate on. So yeah,
Okay.
that is more important. Yeah.
I think pharmacology is one subject which is universally, given
Yeah.
weightage in all exams, I guess. And unfortunately, in NEET, we have this negative marking. And if in AMC exam we don't have that, that's a big plus point which the students
Yes.
can bank on, right?
Yeah.
Yeah. Okay. How does anybody prepare for this particular exam? And would you recommend any books for the same, or would you recommend getting into an institution like whatever you are doing right now, or how is it, how does one candidate go about it?
So again, it depends from person to person. So coming to AMC MCQ,
Hmm.
first of all, you have to forget what you learn in back in your home country. does not
Okay.
work like that. Yes, some concepts are same concepts. For example, if someone has any abdominal pain, someone has appendicitis. Appendicitis is appendicitis. It's everywhere same, but there are some
Yeah.
guidelines and protocols on how to treat it, which is different for Australia. So you have books like John Murtagh, which is very
Mm-hmm.
good book. One can follow that. It's like a Bible for AMC. But you also
Okay.
have good whatever it is, you have to just follow Australian guidelines. You have
Correct.
RACGP, you have RCH, particularly for children, for pediatric population, RCOG for your obs gyne. So like that, you have some websites where you can rely. Yes, I
Okay.
would really suggest someone to get into a course that will ease your life, because when I got into this, in my entire college, from my batch, no one were into this. No one had
Okay.
any idea about AMC at all.
Mm-hmm.
I was just scrolling and scrolling. I didn't know what to do, because USMLE is always a hype, but not AMC. So
Correct.
I didn't
Correct.
understand what to do and where to go. And just on the Facebook, I was searching and I found someone. There's a course called Shari Arts course. There's first aid clinical also available right now. We have
Okay.
Alan Roberts, which where I'm working as well. We have Heal courses as well. There are lots of
Hmm.
courses available now. You can just join them and they'll give you recalls. They will be teaching you topics which are necessary and important. You can, and
Mm-hmm.
it will also help you to follow guidelines. They'll give you mock test and everything. I think that will
Okay.
make everyone's life easy. Yeah.
Oh, okay, perfect. Then, what are the basic qualifying marks? As you mentioned, 50%. Is it the same for both sets, like the
No.
MCQ and this thing? So please brief us on that.
Sure. As I told you, AMC MCQ is 50%, but AMC Clinical is just 20% passing rate. So the passing rate
Okay.
has reduced, just so out of 20 people who go to write the exam, only 2 or 3 people will pass the exam. So the passing
Okay.
rate is less. But
Mm-hmm.
if you do good preparation, you understand how AMC works, I think it's easy to do it. Not that
Okay.
difficult. Maybe because I'm on this side, I'm saying these things.
Right.
But the passing rate has always been 20 to 21% only. It has
Mm-hmm.
also been much lesser before, like only 10% people used to pass, but now it's
Mm.
20, at least 21%.
Okay.
And you have to pass 10 stations out of 14 marked stations to
Okay.
this exam. Yeah.
Okay. Okay.
Overall
Uh,
passing rate is 20, but passing number of stations is 10 out of
10
14.
out of 14. Okay, perfect. So imagine a scenario where a person has cleared MCQ 1, stage 1, but has not cleared the stage 2. Then what can be the next step for that candidate? I mean, should they have to give the step 1 again, or can they apply for step 2? How is it?
Yeah, that's a good question as well, Dr. Anjana. So after step one, normally what we see is USMLE or Plab, they have some kind of expiry date. Like after that,
Yeah, yeah,
your
right.
your part one doesn't matter. You have to redo it.
Correct,
But there's no
correct.
limited attempts here. And once you did your AMC one, your score is logged. I mean, if you pass it, then there's no need to give it again, of course, right? And
Okay,
you can stay that way forever. You don't have to give it again. That's one
okay.
good thing. Uh, Second, sorry, what else was your question?
No, if they have cleared the part 2, then they
Yeah,
can
yeah.
definitely.
Got it.
Uh-huh.
So if
Yeah,
someone has not they're not able to clear AMC two, then
yeah,
what they can do is they can get a job on based on limited registration. Now I cleared AMC Clinical, so I have provisional registration. So after
right,
working 1 year in Australia, I'll get my general registration. Whereas if you
right.
have only AMC one, you can still get a job based on limited registration. You can start
Okay.
working, and you can do like this for maybe 3 year times, and then
Mm-hmm.
probably want you to clear your AMC Clinical, or there is another pathway called as WBA. It's called as
Okay.
work-based assessment. If the
Mm-hmm.
hospital deems that you are a good candidate, a good doctor, then the hospital will say that this doctor is very good, and we want this doctor in our hospital. So then the
Okay.
WBA pathway, they will apply for you, and you can safely skip your AMC two and go that way. But again, that chances of getting into WBA is as slim as that of AMC Clinical as well,
Okay.
20% that much only, and you have to pay almost nearly $10,000, I believe. But again,
Okay.
if someone is doing WBA for you, paying $10,000 is not a big thing.
Right, right, right. Okay, so it is not the end of the road if you're not clearing
Yeah.
part two. You can definitely try for a part two exam again, or else
Yeah.
you have different other avenues as well. So that is a great thing. I mean, that is
Yeah.
really nice. Okay, so then one question we get asked a lot is, recently we also had an interaction with another doctor who spoke about Plab exams. So there also we try to understand the Plab exam in detail, like we're doing now for AMC. So a lot of students ask us, should we prepare for NEET PG? Should we prepare for Plab? Should we prepare for FMCG? Or should we prepare for AMC or USMLE? How is it? So what is your suggestion on that? It is a confused lot for the medicos. So
Yeah.
what is your opinion on that?
I think again it's an individual interest. But if
Hmm.
you're thinking to come to different countries, I think investment is important. You will have to
Hmm.
invest first. So don't
Hmm.
just think that you can directly come here, because AMC is one of the most expensive exams of all the
Right.
exams.
Right.
AMC,
Right.
just booking the exam, it takes you $2,000 to $3,000 just to book one AMC MCQ. AMC
Okay.
Part Two is takes you $4,000, and then
Okay.
if you take any coaching or anything, like Aaron Roberts, it's a bit expensive, but it's very good. Some of them are cheaper ones are also there available. So depending
Hmm.
on what how much one can afford. So overall, if you mix everything, you are seeing an amount of 8 lakhs or something like that. Yep,
Right.
that investment has to be there. Your time has to be invested. It's not a fun exam at all. You have to invest a lot of time to clear it,
Right.
but if you clear
Hmm.
it, your doors of opportunities will open a lot.
Hmm.
Because as if only 20% doctors are clearing AMC Clinical, then of course only 20% of set is going out for work, for
Correct.
provisional registration, then of course your opportunities also will increase. So
Correct.
that's what I would suggest. You can do anything you want in this world. If you want to go to US, you can go any country, but visa is another issue. So
Hmm.
always, like for me, my husband is in Australia. He's been an
Hmm.
Australian citizen, so I did not have to worry about my visa part. But if you're coming by yourself, then your visa will be another issue. Working visa, some hospitals will offer you work visa as well.
Correct.
Then you have to work here, get your registration, then you can convert it into a PR. That's also,
Correct.
at least it's not very worse. You have to work towards it. So
Right.
yeah, visa will be a issue when you go to other countries. Accommodation, and you will be away from your family, food and everything. You have to manage yourself, expenses till you get a job. You have to manage
Correct.
that as well. There should be someone to provide you financially as well.
Yeah.
And these are investment of time is what is important. So I
Hmm.
would say if you're coming to Australia, it's a great place. It's very great for doctors. You can earn a lot. You will have a lot of work-life balance. You'll yourself be shocked, because I have worked in India and I've overworked. I've worked for less amount, free also sometimes, and I've worked so much, so hard. And I come here, there's so much of peace and calm everywhere. So
Right.
it's a shock, and I'm like, what's happening around? So
Right. So that cultural difference is also there when you shift to a different country, and yeah,
yes, these
definitely.
things are
Yeah.
always gonna.
So
Yeah.
right. So my next question would be that only, that that was my next question, as to what is the expense that any candidate will have to keep
Mm.
for this AMC exam. So
Yeah.
you said approximately 8 lakhs. So that is only the exam part, is what you're telling.
Just exam part, yeah. And then you have to
Okay.
stay here, accommodation, God knows there's so much.
Hmm.
And believe me, Australia is very expensive. Expensive than US. People think US is expensive, but it's not.
Okay.
Even USMLE is much cheaper than AMC. Uh,
Okay.
but Australia has a very tax cuts. You have almost 47% tax cut from your salaries. But again, they
Hmm.
provide you with all things like free healthcare and free education to your kids, and all those things are also there. There's also
Right.
good part, good side, downside.
Yeah.
So definitely the most expensive exam I would say is AMC. But
Hmm.
if you're ready to invest that amount, trust
Hmm.
me, it's worth it. It's worth every single rupees you're gonna invest to come here.
Okay.
Even
Okay.
Plab is great. No, not necessarily just you have to do AMC to get into Australian workforce. You can do
Huh.
Plab. And
Okay.
Plab, you have to work there 1 year, get your general registration back in UK, and from there you can get a job here as well. So that is also accepted. But the
Uh,
thing is, you have to work there. So Plab is much easier exam compared to AMC.
Okay,
So
so
yeah,
you're saying that anybody who has cleared a PLAB exam
yeah,
will have to work in UK for a year,
yeah,
and that will be accepted in
yeah,
Australia.
yeah.
So they can start with a registration directly, or how is it?
In Australia, after getting a job, you'll get registration. Normally in UK, you get a registration, then you get a job.
And then you start. Yeah,
Yeah,
correct.
here you have to get a job offer from. You'll be sitting for an interview. Once the
Hmm.
interview is cleared, then they will give you, you can apply for APRA for registration. Once you get your APRA will have to see if you're competent enough for the registration or not, and if they feel like you're competent enough, then they'll give you registration. It will be level 1 or level 2 supervision, depends upon, again, someone who's having a lot of clinical gap, like 5 years of gap, more than 3 years of clinical gap. They have to explain that, get into the re-entry plan. They have to work in level 1 supervision, where again, it should be under, not every hospital will offer you level 1 supervision, because it's like
Okay.
everything you have to watch them, every single thing. So it depends. If you don't have much of clinical gap, it's easier to get a registration here, your provisional
Okay.
registration.
Okay.
Yep. And yeah, so, or your
So,
limited registration. Yeah.
okay, perfect. So once you get a provisional registration, what is the next step? Like what next for any candidate?
So as I told you, provisional registration is for people who have cleared AMC two. Who
Right.
cleared AMC one, they have limited registration. So after
Hmm.
provisional registration, we work for 1 year in
Hmm.
Australian healthcare system, and then we get a general registration. After that, you can work. You can apply for any specialties in hospitals. You can apply for that. Sit for interviews. You will also have exams to be given. That's forever. You have to give your exams, specialist exams, and then continue in that. For example, you can take a general pathway where you have,
Okay.
you want to become, suppose, a nephrologist, a pulmonologist.
Hmm.
You write these RACP exams, and
Okay.
you have to sit for interview. You work as a principal house officer in that particular specialty for 6 months or so, then enter in that as a registrar, and then you'll have exams and everything, and after 6 years to 8 years, you'll be a specialist out.
Okay.
But of course, you'll be earning throughout. So just think this as a promotion. Sometimes what happens is, they might not, if you can't get a job after your
Hmm.
RMO, this is called the RMO year, which you
Hmm.
work 1 year compulsory here. The PGY2, also called as PGY2. If you don't find jobs immediately or as a specialist anywhere, if you're not getting interviews, sometimes you can work as RMO 3 or PGY 3, PGY 4, RMO 4. So you keep
Okay.
on working as RMO years, and the more experience you have in Australian field, the better your chances to get into specialization, because of
Okay.
course they will have more importance to their own candidates, they who have cleared the, I mean, who have done their MBBS specifically in Australian healthcare system.
Universities.
Also,
Yeah.
yeah, countries like Ireland, if you are from UK, you're from US, and New Zealand, they deem you, your education to be equating to theirs.
Okay. Okay, so that is the case scenario. Okay,
Yeah.
as you mentioned, these are all the different opportunities that is available for Indian medicos once they have cleared the exam. I want to ask you regarding the pay parity. You've already mentioned once, but in terms of numbers, if you have to speak, how is the pay parity like in India, and how do you compare that to Australia?
Oh, there's a huge, humongous difference.
Okay.
For example, a junior doctor back in India will
Huh.
earn, to be honest, MBBS. This is very unfortunate, but an MBBS doctor will hardly earn 30,000 a month.
Okay. Right.
Okay,
Right.
that's it.
Huh.
But you will
Hmm.
earn, after tax, I mean, before tax, without any tax cuts, you will be earning nearly 4 to 5 lakhs per
Hmm.
month here. And after tax
Okay.
cut, you get 3.5 lakhs almost, right?
Okay.
So that's a
Right.
very
Right.
big difference. And plus, you also have your leaves, which is a big thing. I cannot stress this
Yes.
enough.
That
Yeah,
that work-life balance is definitely a
yeah,
plus point, and which is needed for the medical profession because it's
exactly.
something which is so demanding, and I think it's also
Yeah.
emotionally demanding medical
Yes.
profession, right? So,
Yeah.
how do you balance that demanding profession, and how are you coping with that? And as I know, your husband is also in the medical profession, if I'm not wrong. Uh, uh,
You're wrong.
so
He's not in medical
so I'm
profession.
okay. I'm sorry. I'm sorry on that. So how are you? How are you? Balancing out that? How are you balancing out that?
I think it's very hard to balance, but somehow, now I've understood, being in this field for so long. Before, I used to always study, study, study. I never had any entertainment source in my life. Only studying was my object of my life. That I felt like
Right.
I live only to study. But now I've understood this is gonna be forever. I can't stop living my life. So work is work. But when I come home, I have my husband, and we spend time together. He's the one who brings the balance in my life, I would say. He takes me out. takes care of me, all my needs and everything. He's there. So I think having a good partner has helped me to survive this field.
Right,
Yeah.
right. That is something which is very much essential, and be
Yeah.
it here or be it Australia, I think that applies to every person, right? Now where do you see yourself in the medical career in a few years from now?
So as I started off like an emergency doctor, but now I see I also am very much interested. I'm right now working in a general medicine ward. So I see I like the way it is, and I really enjoy working over there. So
Hmm.
maybe either I'm thinking I'll be specializing in general medicine field, like either a nephrologist or a pulmonologist, maybe endocrinologist, or I will go towards the emergency pathways. So these are the pathways I have in my mind. So let's see.
Okay. Okay, so you will be definitely planning for specialization going forward, right? Okay, what since we have spoken so much about the AMC exam, and you're also a tutor who is currently,
Yeah.
helping so many students clear the exams. So, what would your advice be to all the young medical aspirants who are listening to this podcast today?
I would say follow your heart, work hard. Medicine is not for weak. Medicine will demand so much from you, but the more
Definitely.
you give in your 20s, the more you get in your 30s. If you're planning to move abroad, remember your challenges are gonna increase, but your
Hmm.
rewards will increase later as well. So
Hmm.
work hard, but don't just limit yourself to this. Have a life outside your work place as well. But when you're
Right.
studying, don't just study for clearing an exam, also study because we deal with human lives. So make yourself knowledgeable and equipped, and remember, no one is greater than anyone. We all are
Hmm.
striving here, studying hard, work hard. That's all I can
True,
say.
true. That's so true, and thank you, Dr. Shaheen. I mean, it has been an amazing session, and I think everybody can agree to this when I say that you have given us so much in-depth detail about the AMC exam pattern, and I'm sure many of them have been inspired by your journey so far that you've shared with us, and many of them will also try and look up to you and take your guidance in future for their AMC preparation. So thank you so much for talking to us today, and thank you. Have a
Thank
good,
you for having
yeah,
me, Tanjana. All
yeah,
the
yeah.
best.
Thank you so
Good luck
much.
to
Yeah,
everyone. Thank you.
yeah.
Bye bye.
Thank you. Thank you. Good day to everyone. Bye.
Bye bye.